Hello there, my reg number is 182365 and this is my dissertation proposal presentation. This is my proposed question. In university athletes, do chronic knee injuries or acute knee injuries have a larger impact on quadricep strength and activation compared to the uninjured limb after full recovery? The proposed title of my research is Knee Injuries Affecting Quadricep Strength and Activation in University Athletes. Many people are victims of chronic and acute injuries in the knee, as this is a common joint to injure. A large number of different injuries can occur at the knee joint, as it is a very sophisticated joint. Therefore, this research is very relevant due to the amount of injuries that can occur at the knee. There have been numerous studies previously on injuries regarding the knee joint. However, a direct comparison between chronic and acute injuries and the effect on quadricep strength and activation is not seen regularly. The aim of my research is to determine which type of injury can have a longer lasting effect on muscular strength and activation after recovery. My study design. I'm aiming to have 24 participants, 12 male and 12 female, and in each of the 12 I'm aiming to have 6 acute injuries and 6 chronic injuries. It will be a randomised sample taken from university athletes willing to participate. All participants must have previously suffered from either an acute or chronic injury to the knee but have now fully recovered in the past 5 years. I will be using an isokinetic dynamometer and a leg extension machine as my 2 pieces of equipment in this research. These pieces of equipment will help me in gathering the data I need to find out the strength and activation in the quadricep, and also to compare strength and activation, as these are often associated with each other. These pieces of equipment are accessible to me, as leg extension machines can be found in gyms everywhere and also on campus in the PEC. And in the biomechanics lab, we have access to an isokinetic dynamometer. I will be using a 5 rep max system to measure strength in the injured and uninjured limb of the participants. To analyse my data, I will be using Microsoft Excel, which will help me figure out the standard deviation and averages in my data. The Excel software makes it easier to analyse the data and to put it into graphs and tables. And the use of tables and graphs are for clarity for the readers, as putting the data into graphs does make it easier to see correlations within the data. I will be looking to compare differences between male and females, and I'll also be looking for any patterns in regards to biological differences in regards to height, weight and age. I will be collecting the data myself, keeping note after each trial, putting it straight into Excel there and then. Therefore, my research will consist of primary data and quantitative data. My findings will be valid and reliable due to me using primary data and also quantitative data, as qualitative data can be up for interpretation when it's gathered. However, with quantitative data, it's pretty straightforward and to the point. Training and supervision requirements. Due to the use of an isokinetic dynamometer, I will need to be trained on how to use the piece of equipment effectively within my research, as it's a very sophisticated piece of equipment. And I will be hoping that a lecturer or lab technician will be able to help me with this. Supervision will also be required, as it is an expensive and complex piece of equipment. So if somebody is untrained in using this equipment, then they will not be able to use it effectively. No training will be required, however, on how to use a leg extension machine, as it is a pretty straightforward machine, and supervision by me will be required with the participant just to ensure that the load is measured accurately and that I can put the data into Excel instantly. Therefore, there will not be any discrepancies in my data. And here is the reference list for my presentation. I'll just leave this up for a few seconds. And that concludes my presentation. Thank you for listening.